then I turned to Roger because he's always doing that kind of thing.
Roger? Where is Roger?
Oh, that's funny. Roger?
It looks like a stroke. How old is he?
He's 42. He's just 42.
More than 25% of all Americans will need long-term care before they reach the age of 65.
Well, I got good news. Your husband's going to be all right. But I need to be frank. With a stroke like this, it's going to be a very long road back. People who go through things like this often take months, sometimes even years of recuperation, and that's after they get home. Now, I don't know what you know about strokes, but you and your family need to start preparing yourselves for a long and sometimes frustrating recovery period.
90% of home care costs and 97% of nursing home costs are not covered by health plans or Medicare. For the first time in our history, there are now fewer teenagers than there are senior Americans. And the ability of our healthcare system to cope with the huge consequences is under challenge from all quarters. Financial security can take a lifetime to build, but health often changes suddenly, and an unexpected illness, or even just the advances of old age, can wipe out years of savings. Then, America's long-term care crisis becomes your family's crisis. More than 2 years ago, Hewlett-Packard began to research long-term care services and providers. Working with U.S. Care, they jointly developed a comprehensive program that included the long-term care most people want, need, and can afford. Most people want care they can receive at home for as long as possible. Most people want to protect their spouse and keep their house and savings intact. And people don't want to suddenly turn into a burden their loved ones have to worry about and care for. The U.S. Care program emphasizes individual choices, freedom. You choose the amount of coverage and therefore the cost to you. And the benefits from the plan can pay for different types of care. From in-home help, when it is practical, to adult daycare, or quality nursing home facilities, where that's the preferred solution. Perhaps what makes U.S. Care most unique is the level of commitment their care advisors bring to the people they serve.
Hello, Mrs. Schmitz. It's Tracy Wilson from U.S. Care. How are you?
The care advisor becomes a key interface between patient, family, and care services, as well as an invaluable resource. Access to U.S. Care's nationwide provider network, available in every state of the Union. The U.S. Care program for long-term care, now available through Hewlett-Packard.
Well, by now you should be much more aware of the value of long-term care coverage. Frankly, HP wouldn't have decided to add this to our benefits package if we didn't recognize both the need for it and its worth to you and your family. We're all aware that the U.S. population is aging rapidly, and costs for nursing and home care are spiraling at an alarming rate. So please, take a few minutes now to review the details of this new benefit. It may affect how you, your parents, and your family members live the rest of your lives.
There is really only one best time to consider long-term care, and that is when you have the opportunity to apply. Thanks to Hewlett-Packard and U.S. Care, the time is now.